Each of the conditions illustrated is associated with an abnormal pattern of respiration which is characteristic. In diagnosis, it's most important to determine whether the noisy phase of respiration is inspiratory or expiratory. Predominantly inspiratory timing suggests upper airways obstruction, as in croup, whereas predominantly expiratory timing suggests lower airways obstruction, as in bronchiolitis or asthma. Having established the site of the obstruction, its severity must then be assessed. The first three segments illustrate infants with croup, ranging from mild to severe. This boy has mild croup. At rest, he has a soft stridor. Observe the mild degree of sternal and subcostal retraction. Note the profuse, clear nasal discharge. The stridor is predominantly inspiratory, but there's an expiratory component reflecting subglottic and tracheal involvement. He's active and doesn't look particularly sick. Notice the characteristic barking cough of croup. This second boy has moderately severe croup. His general condition is good and is not toxic. Sternal recession is more apparent than in the first patient. The barking cough is frequently heard. Stridor is persistent and more marked during inspiration. During sleep, the timing of the stridor during inspiration is now obvious. Note the suprasternal retraction evident here. This child requires very close observation. This girl has severe croup. This girl has severe croup. In contrast to the previous patients, she's irritable, restless and anxious. Her mother is also anxious and concerned. She can't settle comfortably for more than a few moments. This illustrates further her irritability and anxiety. These are the important early signs of hypoxia, which precedes cyanosis and demand early intervention. Observe the very marked respiratory effort she needs to make in order to overcome the obstruction. Despite her efforts to breathe, the stridor is quite soft, suggesting that the obstruction is very tight. It's important to appreciate this point. Note the gross suprasternal retraction here. This girl had to be intubated a few moments after this segment was filmed. This boy was admitted to the intensive care unit 3 hours previously. He has acute epiglottitis. He's sick-looking, toxic, and lethargic. He breathes at all times through a widely opened mouth. Characteristically, at no stage does he swallow, and although it's not evident on the screen, saliva was seen pooling in his mouth. Listen to the low-pitched snoring inspiratory and expiratory noise, contrasted to the higher-pitched stridor of croup. The posture of this child is typical. He prefers to sit upright. As soon as his head drops forward, he wakes. Notice that coughing is absent, in contrast to the frequently heard barking cough of the previous children with croup.